I'm very sorry about this. Okay, so how do we manage cases in Malta? Basically, patients call the public health helpline, an appointment for the swab test is given, they do the swab test, the lab compiles the list of the positive cases, and then the case management team phone up the positive cases and a history is taken. And first of all, history is taken and also to assess if they require hospitalization. So by history, I mean, apart from taking the symptoms, we also need to establish the contact, so the social work and the household contacts. The contacts are then called by the contact tracing team to establish whether they need a 14-day mandatory quarantine according to established criteria. The follow-up team discharges the cases and controls on day 14 with a release letter. And very importantly, the general practitioners were there to follow those in quarantine and with symptoms. So far, to give you an idea, our first documented case was on the 7th of March of last year. Until yesterday, we worked a total number of 30,249 cases. So quarantine brought a number of issues, a number of hardships to various groups that we have identified here. So starting with the elderly, we encountered elderly who ended up on their own, either because their carer was hospitalized. There were also elderly who were unable to cook or get food, and others suffered from dementia. These elderly did not require hospitalization. However, we made sure that we check on them every day. So we called them every day, and we also had visits. They were visited by the ComCare community if they required medical assistance. So ComCare community is a nurse-based unit. Okay, so if they required insulin treatment, for instance. With regards to food, so either cooked food or else just food supplies were provided by several NGOs, all right, who delivered these at their doorstep. With others, we tried to convince a family member to go live with them and quarantine, or else we found an alternative short-term living arrangement in a home until their carer returned. So moving on to children, so autistic children and those with challenging behaviors. There were special arrangements for these children during quarantine, basically to help the parents and also other family members. There were online sessions organized, okay, with their therapists, with their psychologists to help and occupy the child, all right, and also to help the family members. In severe cases, we had to find an alternative accommodation for the child with the help of NGOs. And in other instances, we sent carers wearing the personal protective equipment to the homes of these children to help the parents and other family members because they just couldn't deal with the situation alone. So moving on to cancer patients. We did not stop the treatment for these patients. We made special arrangements with the oncology hospital, the staff and their consultant. Very often we allow them to visit and receive treatment as the very last appointment for the day. What about tourists? Well, tourists planned a very short holiday in Malta, and usually one has an allocated budget to spend whilst traveling, but many ended up in quarantine. So they ended up with no money for food or accommodation. We immediately alerted the Malta Tourism Authority to provide accommodation, and again, NGOs helped us with the provision of food. What about third country nationals? Well, the main issues here were language barrier, lack of food, and usually these live in very, very large numbers in the same household, all right? Sometimes 7, 10, and even more in a single flat. We had difficulty to communicate with them, so we worked closely with interpreters to explain various measures like mandatory quarantine. Again, NGOs helped with the food when necessary, and the positive cases were transferred to a makeshift ward in a hospital to minimize spread. Moving on to migrants. Again, the main issue here was that they live in large numbers, okay, in the centers. We transferred the positive cases out of the centers to a place that was specifically set up for the cases and close contacts to quarantine. Red Cross was pivotal in all this. They provided the medical attention, and they were the ones who translated, helped with explaining what quarantine is and all that, very often using pictures. We also had issues related to these illegal migrants working here, and they were entitled to treatment in another member state, all right, like HIV treatment. So, moving on, COVID has shone the light on social issues. We had issues with domestic violence from an abusive partner. Very often it was against women. There were adolescents that were thrown out of the house by their families when they resulted positive, and other persons who were homeless. What did we do? As much as possible, we kept regular contact with those being abused, and we intervened when required. With others, we helped them find alternative accommodation with friends or extended family or even shelters. So issues with pets, farm animals, horses and crops. Well, quarantine was a huge issue for dog owners, especially if they didn't have a garden or an outdoor area. We asked them to involve family members or someone they could trust as much as possible, and or else use a balcony or roof. If this was not available, NGOs were there to help. Quarantine also affected farmers, okay, with crops and farm animals. Again, as much as possible, we asked them to involve friends, families, colleagues, someone they could trust. If this was not possible, NGOs helped out, and the veterinary services helped take care of farm animals. With regards to horses, horse NGOs were involved to exercise the horses. As you can see on the slide, when it came to medical care, again, if the pet required a visit to the vet, we asked a friend or someone they could trust to take the animal to the vet. Else, NGOs were involved, and when it came to farm animals and horses, the government vets assisted. Mental health. A mental health crisis has emerged during this COVID pandemic. It was hard on all of us, I think, but cases and controls were finding it difficult to cope in quarantine. So we set up helplines, okay, so the Richmond Foundation Helpline, this is a non-profit organization that deals with mental health in the community. There was a helpline for the elderly, a crisis management team, and also online chat services. So how did people know where to call and what to do in case they needed help? We used a number of platforms. So very important is the weekly medical bulletin. This is held by Prof. Charmaine Zahra, the Superintendent of Public Health. There were a number of interviews with specialist doctors on TV and the radio. Social media, we set up a specific page on Facebook and Instagram. We also set up a specific page on the official website of the Ministry for Health. And also, when we initially contacted the cases and contacts, we made sure that we provided such information, okay, such as helplines and other advice and other resources they might use. All right, moving on. So we also identified barriers which hinder the implementation of public health measures. So starting off with the institutions. So the main issues here were lack of infection control training, lack of resources, and no planning. So we involved the Social Care Standards Authority. This is a regulatory body, and mainly they helped with the training, the planning, and also testing. Okay, so random testing, random and regular testing for residents and also staff. So what about workplaces? Well, workplaces were not uncooperating and not implementing measures. For instance, they were telling them to lie to us when we called them. We sent health inspectors to these workplaces. They were closed when required, but very importantly, we educated them, okay? So we gave them advice on measures and quarantine. Obviously, we did this to safeguard the employees and customers. So this was also a barrier for us. It became very, very difficult to put people in quarantine. What was happening? So the people do a swab test, and obviously they were expecting a call. So they were not answering their phone, and they were basically lying about their contacts or places they've been. Some of us were telling us, I don't go out, I don't meet anyone, I don't have friends or family. There was also abusive language towards staff, okay? So all the teams, the case management, the contact tracing, and the follow-up team. And at a point when we had a lot of cases, we were overwhelmed, and at a point we were unable to cope. We had a huge backlog. So this is my last slide, and I think a very important slide. We could not do it alone. The pandemic has hit us all. It affected us all. COVID brought many sufferings, but I believe this was a lesson for all of us in public health. We need to keep in mind every person, every group in our society, in our communities. We cannot work alone. Teamwork was very, very essential. We need a very strong network to help and lessen barriers and hardships. Thank you.
Thank you so much, Charmaine. That was a really thorough and really interesting insight into just a number of barriers. And I think it's really great how you took the opportunity of the engagement through the contact tracing to identify those barriers as well. You okay there? Can you hear me okay? Yeah, so are there any questions for either Charmaine or Tanya? It'd be interesting to see how you identified those different NGOs that you mentioned in the presentation there. Were they identified through the contacts themselves, or did you kind of take the insight from those contacts and then look yourselves at who you needed to be speaking with and who you needed to work with in partnership?
Really, it was work in progress. I mean, when problems were coming in, for example, the first farmer we had with his farm animals, so we realized, and so we got in touch with the veterinary department. We set up policies with them. So it was more along the way problems that we were finding. We then sought the NGOs, other ministries to help us along. I mean, initially, no, we had no idea we were going to find so many hardships and barriers that we would need to deal with when we're dealing with cases and contacts.
Hey, and were you able to share that workload of communicating those barriers between yourselves and those other organisations as well? Because it's hard to kind of capture everything at once, and I suppose working together you kind of avoid duplication. Was that your experience?
No, once we set up the link, and then, like, for example, I mean, the first person we had who told he takes care of 3 horses, and we knew, you couldn't leave them not being fed, not doing exercise. So the first thing we did was get in touch with NGOs we know who are responsible of taking care of horses, and we got them on board, and sort of then once we made the contact and we set up the engagement between them and how they can help us and we can help them, sort of then for the next person that came with the same issue, we could and then use the same people. So it became easier as time passed.
Yeah, well, thank you both so much. It was a really interesting presentation. There's some really valuable insights in there, I think, as well. If there aren't